I've noticed that there's a bit of anxiety that people have around this new world that we're talking about, this kind of end of the medtech industry as we know it. And that's actually a great thing, because we didn't really come to this conference here to be told that everything we're doing is great and fine and we don't need to change it all. We came here actually to experience some tension, to realize that the status quo will no longer be sustained, the world is changing, and we just need to figure out how to change to be successful in this new reality. So when we look at really what's driving innovation, I published a book this last year called Tension, the Energy of Innovation. Because fundamentally, I believe that it's tension that really drives us to become more innovative. And in the book, what I focus on is really defining what is innovation. We use the word all the time, but it's one of those words where I'm not sure we know really what it means. Innovation only occurs when we do something that's new that creates value. When we look at really what drives it, where this new stuff comes from, it comes from failure. We identify failures that exist in the marketplace, failures that exist in people's lives. It's those failures that create pain that cause us to want to change. I tweeted actually one of my comments based upon yesterday's discussion, where I said that we will never see change in this industry until the pain associated with the status quo is great enough to force people to really accept the innovations that we're dealing with. That pain then creates tension. The tension is the energy that drives innovation, and then that leads to growth and success. When we look at failure, the original sin of healthcare is that nobody has ever considered the consumer their customer. Pharma companies, medtech companies, governments, nobody considers the consumer the customer. And because of that, we end up making lots of bad decisions. And those bad decisions now have been driving lots of pain across every healthcare system. And we can debate whether or not my life expectancy years is a good measure of value, but that y-axis is a measure of value. And when we look at the increasing cost of healthcare, clearly the U.S. is the worst. We'll all agree with that. But every country in the world is struggling right now because they're not delivering enough value for what they're spending. And so what that means is that we've got a lot of tension in the system. People are saying we can't sustain the status quo. Things have to be different, have to be better. And increasingly, we're looking at digital health as that innovative capability now that could make things better and enable us to deal with the problems that we've got. So I'm going to pick on Medtronic for a minute here. Medtronic has recently announced 2 new apps. And if you actually understand these apps and what their capabilities are, what they will reveal is that there are 10 fundamental tensions that all of us are dealing with in this industry as we figure out how to innovate. And it's these 10 tensions that really are going to drive our efforts forward to enable us to be successful. So there's the innovation cycle. So the first app is the app for their pacemaker. Now, in this article, they talk about how this app will increase patient engagement. But it's an app that doesn't show you any information. How are you going to be engaged as a patient if you actually use an app that shows you nothing? Now, the claim is that it's going to send your information to a clinician. Well, it's interesting. Partners Healthcare in Boston has a remote monitoring service they provide for hypertension patients where they do blood pressure measures. They did a study where they had half of their patients use a device where the patient had to press a button to send the information to their doctor. And they had the other half of the patients use a device where it automatically went to the cloud to their doctor without pressing any buttons. The mere effort of pressing a button meant that 2/3 of the people never did it. So if you have something as small as the friction of pressing a button, it means it will never be used by most of the people. So if you have an app that doesn't show you anything and requires you to open it up and press a button, it means it will probably never be used.